Well, hello there. This is Dr. Najman Riaz, and today we have something different for you. I usually bring you some videos on our emotional and mental well-being, but today we have a very special guest with us. Her name is Dr. Leslie Madrak. I know Leslie as a friend and a colleague, and she's always been wonderful, extremely helpful, very competent. Leslie's patients love her. If you go on the Google and you'll realize the reviews her patients have given her, which just shows what a compassionate, caring, but above all, competent physician and a psychiatrist Leslie is. Dr. Madra graduated from Philadelphia College of Osteopathic Medicine in 1997. She did her internship and her training in psychiatry at the University of Medicine and Dentistry of New Jersey School of Osteopathic Medicine, and that was in Rowan University. She's a board-certified psychiatrist, and she is also certified from the American Board of Integrative and Holistic Medicine and American Board of Addiction Medicine. She has also received certifications in psychedelic-assisted psychotherapy by the Integrative Psychiatry Institute. I didn't know that, Leslie. That's amazing. Wow. Looks like we have to bring you back here to talk about that. It's a hugely growing field in this day and age. Dr. Madrak started as assistant professor at UMDNJ SOM, and she was there for about 10 years. She was a director of the dual diagnosis unit at Hampton Behavioral Health, medical director at Camden County Health Services Center, and interim medical director at Kennedy Behavioral Health. After that, she did do general psychiatry and medication-assisted treatment for those with opioid dependence at Psychiatric and Addiction Services of Southern New Jersey for about 7 years. Dr. Madrak joined Jefferson Health in New Jersey, and she worked there as medical director of behavioral health. And that's how I came to know Leslie. Dr. Madrak has been awarded as one of the top docs by South Jersey Magazine for both psychiatry and addiction medicine in 2018, 2019, and 2006. Currently, she continues to provide outpatient care at Jefferson Health, assisting with both mental and addiction-related disorders. So we are so blessed and so excited to have Dr. Madrak join us. And we will ask Dr. Madrak some questions about opioids. What is addiction of opioids? How do we treat it? But more so, how do people get addicted to opioids? So we're going to just start with some basic questions. And again, thank you so much, Dr. Madrak, for joining us in this conversation. And
thank you so much for having me.
Of course. So to begin with, not many people know what opioids are. So what are opioids, and how would folks out there know that the medicine that they're being given by their providers, mostly after they have surgeries or procedures and they have pain? So how would they know that the medicine that they're taking is actually an opioid?
Well, that's a very good question. I think asking questions with your medical provider is the most important thing. And because we know the potential dangers of opioids, whenever we're taking any type of pain medication, we should start with asking that question. And I think that it's important that we ask if there are any potential alternatives to that, since we can become dependent and have tolerance, and we will get more into that as time goes by. But I believe that if there's an alternative that can be used for moderate to severe pain, starting with, say, for instance, acetaminophen, ibuprofen, potentially there are other medications such as anticonvulsants, antidepressants, muscle relaxants, many of them that are safer to use before going to that last resort of the opiate narcotic pain medication.
As you said, is that it should not be the first line of medications to use for any kind of pain, that there are other medicines that we can use before we pick the opioids. I know many people in this day and age, they're well versed with medications. Many people know what antidepressants are, what medicines like mood stabilizers are, but there is still a lot out there since our audience is mostly global. So there are still a lot of people who exactly don't know what are opioids. So just for them, Dr. Madrak, share with us a little bit about what are these medicines?
Yes. So the opioid, and sometimes the word opiate is used, and sometimes the word opioid is used. And sometimes they're used interchangeably, but the opiate is really referring to that natural medication as opposed to the synthetic, that is a derivative of opium and the poppy, a flower. So those medications are things like, say, morphine, codeine, even heroin is a derivative of the actual poppy. Then there's some semi-synthetic medications that are more in the category of oxymorphone, oxycodone, hydromorphone. Then there's some other synthetic ones that maybe people have heard of, such as fentanyl, tramadol, dilaudid, Demerol. All of these medications can be used for pain, and they are prescription medications, and they all have the potential to be dangerous over periods of time.
I hear you. Okay. So basically, the opiates or opioids is a class of medications that are derived, as you said, from this opium, which comes from the poppy. That's very interesting because I know in many countries or some, Southeast Asian countries where poppy is grown in the fields. So a lot of people get addicted directly to opium rather than the prescription medications that they're given. But I know in most of the countries, folks do get addicted to the pills, which is the prescription pills. So Dr. Madrak, the population that you see, whoever comes to you who has struggled with opiate addiction, what do most of them say about like what has been their journey with this addiction? How did they even get addicted in the first place?
Yes, well, it may be surprising to a lot of people because I think there is a misconception that a lot of people start becoming addicted because of a curiosity or a desire to get high or feel a euphoria. It's usually not the case, not in the patients that I've seen. In this country, in the United States, there's quite a few people that are using oxycodone for medications such as an injury or surgery. And typically that's how it begins. Someone has an injury or they have chronic pain issues. And as a result of that, our bodies become more and more dependent on them the longer that we use them. And it actually really doesn't take very long for us to become tolerant and dependent to these medications. Actually, for some people, even within several weeks, they may start noticing some signs and symptoms that things are moving in not such a great direction in terms of potential withdrawal and things of that sort.
I hear you. So basically, most of them are accidentally addicted or dependent on the opiates. I mean, you're a specialist and you see so many clients in your practice. Share with us, like, say, for example, I have had a surgery and a doctor hands me 2 weeks of medicine of oxycodone and I take it, my pain goes away and I like it. I also like the feeling that it gives me, as you said. And after that, I noticed that when my prescription ran out, my pain is back and I just missed that good feeling from that oxycodone. And then I go to the doctor and get another prescription. He fills it up for me. How would I know that I actually have become, or it has become a habit forming for me? I have become dependent on this medicine. How would I know that?
To answer your question, I think that many people over time, if they're on it long enough, we are all going to have either a tolerance or a physical dependence, because that is just the way the medication works. And I also feel like it's a perfect storm in some situations. Like, why do some people become addicted and why do other people not get addicted? I think it has to do with what other kind of stressors do we have in our lives? Do we have any comorbid mental health disorders? Is there depression? Is there anxiety? Or going through a lot of different stresses in our life? Do we have maladaptive ways of coping with stress? And this would be a very easy one to latch on to in order to deal with that stress. But I think some of those signs and symptoms might be if you suddenly feel like you're taking the same dose of a medication over a period of time, and then all of a sudden that dose does not work anymore. And you find yourself needing higher and higher doses to get that same effect or that same pain control. And that's what we call tolerance. There's also what we refer to as dependence, and that may mean that the person may get some physical withdrawal symptoms if they stop taking the medication. And if people really become dependent, those symptoms can happen even within several hours of taking a short-term pain medication, such as something like oxycodone.
Oh, wow. That is so interesting. Because, see, not many people know that. Because, we take the medicine and we realize it's doing its job, we feel good. But then we notice that we're not feeling as good as we were before. And then we feel like, I need a little more. So what you're saying that medically, that is called a tolerance, and that people should be aware that if that happens, that you have become tolerant to the medication. And at that point, Dr. Madrak, what should a person do if they notice that they're asking for more, that they're needing more medicine? And how can their providers help them to recognize that?
Yes, I think when we are treated with these type of medications, as you suggested, we really have to keep the medication at a minimum, because not only can we feel this physical dependence, but we can also have that emotional dependence on it as well, which is really where that physical and emotional, where that addiction part comes in. And I think we really have to have open communication with our medical care providers and say to them that we really want to be on the lowest dose of medication if it's absolutely necessary, and for the shortest amount of time to prevent that from happening. And if you see that you are becoming emotionally dependent on it and you tend to need more, then to really ask your doctor for some help, which that may mean other types of intervention at that point to help you with coming off these types of medications.